I know this is going to be controversial, but I'm going to say it anyway. Psychiatric medications are not the answer. Now, before you keep scrolling or roll your eyes, let me explain. My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist, and yes, I use psychiatric medications every day in my practice. And yes, I recognize that they can be a crucial component to someone's treatment plan, helping to reduce their symptoms so that they're better able to function in the day-to-day process, as well as target underlying causes of what might be leading to their mental health symptoms. But I want to be clear here that psychiatric medications are not curing mental illness. They're not curing some neurotransmitter imbalance. We know that that theory has never really been proven. It certainly is a convenient theory for people that want to sell medications that correct these neurotransmitter imbalances. That being said, can the medications be helpful and even life-saving in some cases? Absolutely. But they're not curing anything. And there can be lots of risks associated with psychiatric medications, as well as development of tolerance and dependence over time, not just for things like benzodiazepines, but antidepressants as well. And trying to get off of these psychiatric medications can be incredibly difficult. So what am I saying here? That everyone should try to get off of their psychiatric medications at some point? Well, I think that would be great if it were possible, but I also recognize that that's not possible for a lot of people, and that a lot of people feel best with a combination of their psychiatric medications and lifestyle and or therapeutic interventions. My job is to really support patients in whatever their goals are, if they want to stay on their psychiatric medications, if they want to get off their medications. But I think it's important that we keep in mind on both ends that one, psychiatric medications are only reducing symptoms, and that it's important to address what's really going on, whether it's metabolic dysfunction, some trauma. At the same time, for those who want to get off of their psychiatric medications, it's important that we've made some effort to address these underlying causes, because otherwise the likelihood is that the symptoms that you had prior to starting the medications are going to return and maybe be worse because they're compounded by withdrawal symptoms from the psychiatric medications. So all this to say, I see psychiatric medications as a tool that we use to reduce symptoms in people, recognizing that they are necessary and life-saving in some cases. But in others, they can be really detrimental for people. And so I think it's important to recognize that each individual has a different experience with psychiatric medications as well as their mental health journey, and that the decision of what to do with medications and what other interventions to pursue should really be something that is between the provider and the patient based on the individual's risks versus benefits of their condition and the medication, etc. If you have any comments or questions about this, feel free to share in the comment section below. Wishing you all good mental health today, and I'll see you in the next one.